How well a person tolerates exercise is related to the existence and severity of coronary artery disease, other heart disorders, some other disorders such as a lung disorder and anemia, and general fitness. An exercise stress test, which consists of ECG and blood pressure measurement during exercise, can detect problems that would not appear at rest if the coronary arteries are only partially blocked. The heart may have an adequate blood supply when the person is resting, but not when the person exercises. Because an exercise stress test specifically monitors how the heart is functioning, the test helps doctors distinguish between problems due to a heart disorder and those due to other disorders. Electrodes are attached to the chest to record the ECG. During the test, the person walks on a treadmill or pedals an exercise bicycle. People who cannot use their legs can use an arm crank. Gradually, the pace of the exercise and the force required to do it, workload, are increased. The ECG is mounted continuously and blood pressure is measured at intervals. Usually, the person being tested is asked to keep going until the heart rate reaches between 80% and 90% of the maximum for age and sex. If symptoms such as shortness of breath or chest pain become too uncomfortable, or if significant abnormalities appear on the ECG or blood pressure recordings, the test is stopped sooner. Testing takes about 30 minutes. Exercise stress testing has a small risk. The chance of its causing a heart attack or death is 1 in 5,000. People who cannot exercise can be evaluated using pharmacologic stress testing with ECG. This procedure provides information similar to that from an exercise stress test, but does not involve exercise. Instead, a drug such as dipyridamole, dobutamine, or adenosine is injected to stimulate the effects of exercise on blood flow. Exercise or pharmacologic stress testing suggests coronary artery disease when certain ECG abnormalities appear, chest pain develops, or blood pressure decreases. No test is perfect. Sometimes these tests show abnormalities in people who do not have coronary artery disease, a false positive result. And sometimes tests do not show any abnormalities in people who have the disease, a false negative result. In people without symptoms, especially younger people, the likelihood of coronary artery disease is low, despite an abnormal test result. Nevertheless, exercise stress testing is often used for screening purposes in apparently healthy people. For example, before an exercise program is begun or during an evaluation for life insurance. However, in such cases, a positive result is usually more likely to be false than true. These false positive results may cause considerable worry and medical expense. For these reasons, most experts discourage routine exercise stress testing in people who do not have symptoms. The accuracy of exercise stressing can be greatly increased by injecting a tiny amount of a radioactive substance, a tracer, such as thallium. However, the added expense of this procedure makes it inappropriate for routine screening. Abnormal heart rhythms and inadequate blood flow to the heart muscle may occur only briefly or unpredictably. To detect such problems, doctors may use continuous ambulatory ECG, in which the ECG is recorded continuously for 24 hours while the person engages in normal daily activities. For this procedure, the person wears a small battery-powered device, Holter monitor, held on with a shoulder strap. The monitor detects the heart's electrical activity through electrodes attached to the chest and records the ECG. While wearing the monitor, the person notes in a diary the time and type of any symptoms. Subsequently, the ECG is run through a computer which analyzes the rate and rhythm of the heart, looks for changes in electrical activity that could indicate inadequate blood flow to the heart muscle, and produces a record of every heartbeat during the 24 hours. Symptoms recorded in the diary can then be correlated with changes in the ECG. If necessary, the ECG can be transmitted by telephone to a computer at the hospital or doctor's office for an immediate reading as soon as symptoms occur. An event monitor is used when a person must be monitored longer than 24 hours.